Hi, and welcome to our first Loved webinar. Um, we are so happy that you all decided to join us and take some time out of your busy schedules to listen in on having a conversation with pet parents, especially when their pets are aging, can be difficult. And this webinar is designed to hopefully offer some indicators as far as what to look out for, but also potentially how to start the conversation itself. Um, this is geared towards individuals of the support team of a hospital, all the way to daycare individuals, groomers, trainers. So truly, many people can benefit from this in order to help pet parents recognize shifts and changes as their animals start to age and what to do and who to call. So my name is Stephanie Bose. I am honored to be the medical director of Loved Veterinary Services. We were founded in Central Florida out of Lakeland. And so we happened to come upon a wonderful individual, Dr. Lindsay Campbell, in the Tampa area. And she will be kind of going through her service area. She is a University of Florida graduate when it comes to veterinary degrees in medicine, but also her undergrad. So awesome job
Okay.
there. She enjoys some time with her family and her fur babies. Please welcome Dr. Lindsay Campbell, and I'll go ahead and pass it on.
Yes, thank you, Dr. Stephanie. Like she said, my name is Dr. Lindsay. I'm just going to share my screen here. I won't take too much of your guys' time tonight, but we're going to talk kind of through those conversations, some of those difficult conversations that we have with our pet parents when we start to see some of those changes in our pets that are some of those classic changes we see in our seniors. So we just wanted to talk a little bit about how to approach these conversations gently, maybe some of the things to bring up. There is a little chat box. If anybody has any questions, we can definitely touch on questions at the end. But it looks like you guys can see my slides okay. So we'll just kind of go ahead and start. Like Dr. Stephanie said, we are Loved Veterinary Services. I am the Tampa specific veterinarian. So when you are referring clients to us, it will be me as the veterinarian going into those homes. And I can show you guys kind of our radius for Tampa and Lakeland areas. We cover a pretty vast region when it comes to Tampa and Lakeland, and we've even expanded into Houston as well, but today we're kind of just focusing on Florida. So in Tampa, you can see we're going as south as South Tampa, we're going east into Temple Terrace and Wesley Chapel, we're going pretty far north in Land of Lakes, and then a little bit more west in West Chase and Town and Country. So we're kind of hitting all of those major Tampa and surrounding areas. You've met Dr. Stephanie, our medical director and our head Lakeland vet. And then Holly and Haley are two important members of our team. They are our client care coordinators. And what that means is that they are going to be a lot of times the very first person that our pet parents are going to reach, either via text or via phone call. It's probably going to be Holly or Haley picking up. And I love that because I know that we've got our local hearts, and Holly and Haley do such a wonderful job of talking pet parents through these difficult conversations. And a lot of times, our pet parents will even bring up, I talked to Holly or I talked to Haley. So it's a memorable conversation for them. And when we're staying in touch, it's these familiar names that our pet parents are going to see over and over again throughout the process. So we've got our local gals that help out here. Tonight, I wanted to talk a little bit about common signs of aging and decline in pets that we see, especially in our clinic setting, how to communicate concerns to owners, things that we're noticing in those typical exams, or maybe like Dr. Stephanie said, if you work more in the grooming or daycare industry, some of those changes you're noticing. Recommendations and tips and tricks for our pet parents, things that you can go ahead and recommend or write down or send them links for, and just different ways to help out our pet parents with their senior babies. And then I wanted to talk about what we provide as Loved. And then, of course, our discounted services for our veterinary staff and our grooming industry staff. You guys work day in and day out to take care of all those fur kiddos. So we want to make things a little bit easier on you when it comes to making some of those difficult end-of-life decisions. And then some of our resources for grieving pet parents. We love our resources because this is something that I can pass along to you guys to utilize in your clinic or grooming or daycare setting. It does not necessarily need to be our clients specifically, so definitely save that slide when we get to it. So what are some of those common signs of aging in senior pets that we notice? I often find that these are the first things that we are going to notice, especially when you're working in a clinic setting and maybe you haven't seen Fluffy since his annual exam a year ago. Or maybe you're working in grooming and you see a pet every 4 to 5 months. And all of a sudden you start to notice every time they come through the door, there's a little bit more of those visual changes. Maybe they had kind of the same appearance for a few years, their adulthood, and then you're starting to notice some of these changes. And some of these changes are a little bit more difficult for pet parents to notice as well. When they're seeing their pet every single day, sometimes they don't notice the really subtle changes. You might be seeing things like graying around the muzzle or other areas of the body. That's kind of a classic presentation, like this pup up top. We're starting to see some of that graying, or I like to call it a frosted face. Our kitty cats, especially like our orange tabby in this picture, might start to become what we call unkempt. And essentially what that means is they're going from that shiny, glossy, looks like it's freshly groomed coat to maybe more of that chunkier or even oilier appearance to their fur. That's a really common one that we'll see in our older kitties. And that change can come from a couple different things. It can come from different disease processes or even secondary to them. For example, if we've got an arthritic kitty cat, that it might just be a little bit more painful for them to do some of those kitty yoga poses that they have to do to groom themselves. A lot of times we'll notice cloudiness to the lens, so our pupil space in the eye. And this one I feel like is a common one for pet parents to bring up to us. I think a lot of pet parents have a misconception that they're all cataracts. So you might be used to pet parents saying, oh, Fluffy is starting to get cataracts. And that's something that, as you can see in the pictures on the right side and then the bottom right picture, a lot of pets that are seniors will experience something called lenticular sclerosis, or you might call it nuclear sclerosis. And that is going to be where you can still see through that lens, that pet can still see you. That is just an age-related change that we see in pets' eyes. And a lot of pet parents will notice that as well and bring it up to you. Cataracts are going to be more of that like stark white, bluish appearance where it's truly, truly affecting that pet's vision. And a lot of times that's going to spark conversation of, hey, maybe we should do some more diagnostics to figure out why this is happening. So that's a common one for pet parents to bring up to us. Muscle wasting is something kind of classic that pet parents might not notice, but you might after those few months of not seeing them. And that's going to be when you're petting Fluffy and all of a sudden you're starting to feel his spine a little bit more, or maybe the crest on the back of his head or his hips. And sometimes pet parents won't notice this as much. I think grooming staff probably notices this a lot, especially with those fluffier animals when they're washing them down and can actually kind of see some of those underlying bony structures in our pets and some of those changes over time. And then stiff gait is going to be a classic one. A lot of times our CSRs or receptionists are going to notice this one as soon as that pet is walking through the door. Fluffy might be walking a little bit slower. He might be slower to get up out of bed in the morning. So stiff gait's going to be a common one that, again, pet parents might not notice as much when they're seeing this every single day. What are some of the health changes that we're noticing especially in our veterinary appointments? Visual and hearing impairment is one that pet parents will notice a lot. They'll say, Fluffy has started to kind of bump into things, or maybe it kind of scares Fluffy when he's sleeping and I touch his back and he's startled. So that is one that they'll start to notice a little bit more at home. We notice a lot of different diseases in our seniors, unfortunately. So with age comes diseases. So whenever these pets are coming in to the clinic, we are going to be more commonly diagnosing diseases in some of those older populations than we are in some of those younger puppies or adults. Lumps and bumps. I mean, we see this all the time. I know my babies have some lumps and bumps on them that I'm monitoring. So like you can see in the picture in the upper left, that's going to be a really common sign of aging. We typically aren't going to see these in our youngins. Of course, every once in a while you see some of those cases, but typically those are going to come with age more commonly. And then signs of osteoarthritis. So just like I mentioned on the last slide, some of that stiff gait, or maybe showing some more signs of pain at home, maybe not being as willing to go on those longer walks or wanting to jump up on the bed at night. And I think this is really important for us, especially when it comes to our kitties, because, with dogs, they are a little bit more vocal and obvious about their osteoarthritis. And a lot of times it's easier for us to diagnose this on exam for a dog. But for our kitties, a lot of times diagnosis for our osteoarthritis comes from our discussion with the pet parent. So what changes are you noticing at home? Is your kitty not wanting to jump up on their cat tree like they used to? Are they sleeping more on the ground versus the couch or the bed like they used to? Are there little changes that you've noticed in your cat at home? And this is really important as a first step for especially our veterinary technicians who are taking that history in an exam room. Start to ask these questions as soon as these cats are reaching kind of that senior age of 9, 10. Ask those questions early on so that pet parents can notice these changes on their own at home. We might start to see some weight and appetite fluctuations in our seniors as well. And this can kind of go one way or the other. For example, we talked about muscle wasting, and weight loss is common in our senior pets as well. Some disease processes can also cause some weight loss and a lot of fluctuations in appetite. Maybe this is the first sign that we see of kidney disease, is actually that we're starting to skip meals and maybe we're feeling a little bit nauseous. And then you have the other side of things where Fluffy had been a constant 75 pounds every year you saw them, and now all of a sudden they're 85 pounds. So we have to look at, is this because he's not as active? Is he gaining weight because he's got some arthritis that we need to help manage? Is he gaining weight because our thyroid is slowing down? So it's really important for us to look at that trend of weight over time. And if you're starting to see a big chunk of weight loss or a big chunk of weight gain, that might be a sign of something underlying happening that we need to dig a little bit deeper and ask those questions to our pet parents. And then incontinence, so just like the cutie and the purple diaper in the picture, we can experience some urinary or bowel incontinence in our senior dogs. Bowel probably less or so caused by underlying disease. Urinary can definitely come with some of those diseases that our seniors like to present with. So especially with urinary incontinence, that's one of those things where we do want to start up that conversation of, should we be performing some x-rays or some blood work and urinalysis just to make sure this isn't coming from something else that's primarily causing it. And then behavior changes. This one is often overlooked and something that a lot of pet parents don't realize might happen in their senior pets. One thing that we see a lot is that our seniors seem to be a little bit more confused or even more distant sometimes. A lot of pet parents will tell me that their pet has selective hearing. So maybe we know that their hearing is okay, but now Fluffy, you have to call his name 4 times when he's standing in the yard to get him to come back in. And then, like I said, seeming confused or a little more distant. Sometimes they'll kind of want a little bit more space. Sometimes they become a little bit more introverted in their senior years. We do need to make sure that these are signs of something underlying, something else going on, them not feeling good or feeling some chronic pain for some reason. And then sleeping more. Our seniors, our dogs and cats are naturally going to be sleeping more with age and have less energy. Just overall, they're not going to be running and catching the frisbee like they used to. We might need to modify their walks and their exercise a little bit different than we did a few years ago. Seeming a little bit more irritable or anxious is common in our senior pets as well. They might be fine going to the vet when they're 6, 7 years old. They might love it. And then when they start to become older, they might get a little bit spicier at the vet clinic. So that is kind of one of those signs that we notice in our seniors. And a lot of times this is coming from, they do have decreased senses. So maybe they have less visual or hearing ability. So things can be a little bit scarier for them. The vet clinic maybe used to be exciting, and now it's something that might be a little overstimulating for them. And they might be a little bit more irritable at the vet or even at home. I notice this a lot too when it comes to senior pets. They tend to be a little bit more sensitive to touch. They tend to get a little bit startled more easily. And sometimes that can come from some of that chronic pain as well. So a lot of things that can help to start that conversation with pet parents of, do we need to do more to figure out what's causing these changes? And then something that we commonly see is also going to be cognitive decline, just like we are used to in our humans, our people is going to be things like what we call doggy dementia or canine cognitive dysfunction, or in our kitties, they have very similar bodies and brains to us and go through similar things as well. So we might start to see some cognitive decline in our senior pets. I feel like a lot of times pet parents will bring this up as Fluffy maybe paces at night a little bit more, doesn't seem to be able to rest at night. Again, with the selective hearing, maybe Fluffy has been staring into walls or corners randomly. And there's a lot of different ways that we can support our patients that are cognitively declining. And that's why it's so important to bring up cognitive decline to pet parents. Maybe they're noticing it and bring it up, or they start to mention some of those things and you want to bring up that it's more cognitive related. And that way we can kind of direct our recommendations for them specifically when it comes to cognitive things. So I can kind of touch on some of those recommendations as well. Now, how do we approach these conversations with pet parents? So again, whether you're a technician or you are this pet's regular groomer, it is important to gently approach these conversations. It can be kind of startling, especially if that pet parent doesn't have anyone else that is bringing up these things or these changes that they're noticing to them, or maybe they haven't noticed them at home themselves. So important aspects when it comes to approaching these conversations. Number one is going to be leading with empathy. Put yourself in their shoes and think, how would I feel if I started to see these changes after having this pet 1 year, 14 years, all the same? We care for them so much. And this might be a really tough topic for our pet parents. So it's not something we want to pressure them to talk to about. If you have any concerns, it's really good to ask broad questions. Just, how has Fluffy been doing? Or maybe, I noticed this change in Fluffy recently. Have you noticed this change, or others at home? And that way you're just gently approaching the conversation. You're kind of opening up the floor for them to start talking. And that leads me into point number 2. A lot of times in veterinary medicine, when we are in that exam room or that appointment, the vet staff is doing a lot of the talking. The vet tech or the vet or the CSR or the groomer, we are the ones doing the chatting, the talking, the educating, the question asking. This is a really unique space in that we need to shift gears and focus on just listening. We need to let the pet parents lead these conversations and not talk over them. We need to give them the space to talk and be okay with silence. It's okay if you need to sit there while that pet parent is truly thinking back to, man, he really has been showing me some of these signs at home. Or, yeah, actually my cat has not jumped on the counter like she normally does in the past 6 months. So silence can be a great tool for just allowing our pet parents to kind of reflect. This might be the first time that they've actually kind of sat in these thoughts and thought through them and processed them. And so it's an honor to be able to sit with them and kind of help them through what they're thinking and what they're noticing at home. So guide them through these conversations and what they're feeling and thinking. It is good to stick with the facts rather than your opinion on the situation. So we can present things to them such as Fluffy has lost 10 pounds, or Fluffy is showing me signs of Cushing's disease, or Fluffy is showing me that he's a little bit painful in his hips or his knees. We want to lead with more factual things, and then that gives owners the space to lead with more of their kind of how they are feeling about the situation or feeling about these changes in their pets. It is not necessarily our job to define that pet's quality of life. That pet parent knows them better than anyone. So we're going to help kind of bring up these changes and maybe help diagnose or treat or manage these changes. But when it comes to quality of life and the opinion of how it's affecting that pet, that is going to be a key job of our pet parents at home. And choose the time and place wisely. Remember that these conversations, they can be really heavy for our pet parents. And it's important to read the room, determine if this is the right place and time to talk about it. When you've known a pet parent for some time, they might actually bring these things up to you. Like I said, our groomers tend to see our pets more than the vet does. So a lot of times our pet parents will form a really trusted relationship with their groomers or daycare if they're seeing them frequently. So allow them to bring up these conversations as well. But it is important to have a safe space for them to talk about these things because, again, it can be really difficult. It can bring up a lot of emotions. This might be the first time that it's been brought up to them. And so if you have maybe a pet parent picking up their drop off in the lobby and you want to talk to them about some of these serious concerns that you have, maybe ask them if they have a couple minutes to step into an exam room, give them a quiet space. It's going to be a lot harder for them to talk about these things in front of a full lobby of other pet parents and pets, especially at like a grooming or daycare facility as well. And then recommendations for owners. So some of these are going to be great tips that you can send home with owners yourself. The biggest one, and the one that I get spoiled going into people's houses, is that I get to see the environment of that cat or dog. So consider their environment. This is something that is going to really come back to history taking and just having a really good conversation with the pet parent, especially if you're seeing them in a clinic, daycare, grooming setting. You're not able to see what's going on at home. So these are some of those questions that you can ask pet parents about their home environment and provide recommendations. For example, is it easy for this pet to get around? Do we need to add some ramps or some steps to their favorite spot? I know my dogs use steps to get up to my bed every single night, and I don't know if they would sleep in bed with me if they didn't have those steps to kind of help them up there. A lot of our Florida homes, unfortunately, have the slippery tile or don't have a lot of rugs placed down. So can these pets benefit from different mats? You know, our arthritic pets benefit so much from, even if you want to grab some yoga mats from Five Below and put them down in some of those really commonly used areas that pet is, you know, going from couch to maybe outside to where they drink their water and eat their food. It's really easy to find yoga mats or runners that can help them to get around the house a little bit easier. And we have so many options, especially if you look online or on Amazon and look up for anything that can help with some friction on our paw pads. I've seen different booties. I've seen different types of paw pad friction that you can actually glue on the bottom of their paw pads that last for a week or so. You can see in the picture, the purple looking toenails are actually toe grips. So those are little plastic pieces or beads that go on the toenail itself. And those can help to provide some stability and help prevent slippage, which slippage is common in our senior pets and can be really painful for them and cause injury as well. So all these things can kind of help make their environment a little bit easier to navigate. Would they benefit from night lights or various padded beds around the house for extra comfort? These are going to be important ones for those cognitive kiddos that I mentioned. So when it comes to cognitive decline, a lot of times we're seeing those changes maybe at nighttime. So night lights around the house, and even placing like a bed near that night light so that they know, okay, that's one of those options of a comfy spot I can settle tonight, versus finding them off in that bathroom on that cold tile because they just could not kind of figure out their way around the house that night. So providing them with that support, especially even past the time that you go to bed, night lights can be a good way to support them throughout the night. Maintaining a consistent routine. I think this one is so important and often gets overlooked. Our senior pets are going to thrive on a consistent routine. That means trying to keep things consistent when it comes to our potty breaks, our food, just kind of everyday life. The better, or the more consistency that we have with that routine, the better that they're going to thrive. And then physical and mental enrichment and stimulation. This one is often overlooked as well. A lot of us probably go off to work during the day and come home and we enjoy the time that we have with our pets, but there are different ways that we can provide enrichment, whether when we're home or even when we're away. And both physical and mental enrichment can keep our pets younger and healthier longer, kind of like making that grandparent do Sudoku. This is something that can help to keep their minds a little bit more aware and awake. And for example, my dogs love popsicles, or I call them pupsicles. And those are just frozen treats that I have prepped for them with a little bit of chicken broth or Greek yogurt or peanut butter. And instead of them sitting on the couch and snoring and snoozing next to me for 20 minutes, they get a little popsicle that they have to work at, and they have to roll it around and think about it. I'll put them outside with one, and they get to enjoy some of that sunshine and get their little popsicle. So there's so many different kinds of mental and physical enrichment that we can provide for our seniors. When it comes to medical concerns, these should be addressed at a veterinary appointment. And I would say 99% of the time, if a senior dog has not been to the vet recently, they can benefit from it. So they can benefit from, of course, that thorough exam that should be done probably every 6 months, if not more, in our senior babies. And they're going to benefit from blood work. If they do have any of those lumps or bumps, maybe we need to talk about sampling and different ways to monitor. A lot of our senior pets could benefit from some joint supplements, or like our fish oils or omega-3s to help with a lot of different things in our seniors. Pain management often gets overlooked, and that's something that needs to be established with a veterinarian. And then dental care is very common. We all know those older pets with the stinky breath and dental disease. So that's a really common one that we need to address for our senior kiddos. So what do we provide as Loved Vet Services? When your referrals or the clients will reach out to us, they'll either reach out through our website or by texting or calling. This is great because a lot of times these are really difficult conversations for our pet parents. So they might prefer one way or the other. They might say, I am not a texter. I need to talk this through on the phone. Again, Haley and Holly are going to help lead them through that conversation. Or maybe this is really, really difficult for them to pick up the phone and even call. And texting is going to help to guide them through the process, but they don't need to worry about talking to someone specifically on the phone. Our appointments are 2 hours long, so they're very unhurried appointments. This allows for ample time for our pet parents to express their concerns and feelings, especially if we are talking more about a quality of life assessment. We do not want them to feel rushed in making decisions. We don't want them to feel pressured. So we are going to quite literally probably sit with them on their couch in their living room with Fluffy in between us. And we are just going to chat, and we are going to talk through everything that that pet parent is feeling. So the moment that we walk in that door, we want them to feel supported, and we do not want to feel like things are in a rush at any step of our process. We're going to start with that discussion, and then we'll perform an exam in the home. And if euthanasia is pursued, we will explain what that process might look like, which I think is a really important part of helping to guide parents through euthanasia, is just preparing them for what they might expect for that next half hour or that next hour. things that they might notice or might see. And that way we can kind of talk through them before they're happening. Our appointment options include a quality of life assessment. So that might include management or checking in on them moving forward, or in-home euthanasia. And we will take care of aftercare as well, depending on what that pet parent's preference is, which if you work in a veterinary clinic, you're probably very familiar with some of those aftercare options. The price for our quality of life assessment or euthanasia appointment is that $485. We have that as the same pricing because if it is a quality of life assessment appointment that navigates towards an in-home euthanasia, we don't want to be talking about an additional charge for the euthanasia. We want them to be able to focus on the pet in that moment, and that's why we have that same pricing for those two appointments. We do have an additional fee for our larger dogs, and then our aftercare pricing is going to vary depending on that pet parent's preference. We work with Faithful Friends as our crematory in Zephyr Hills, and so they provide private and communal cremation, which we call our gentle transportation. And then something that's really special about our team is that we personally will be taking any cremains or memorial items back home to those pet parents ourselves in a very timely manner, usually within a week or two. And that's a part that I really enjoy because I get to see those pet parents again. I get to check in on them. A lot of times they've found old pictures or remembered stories about their pet that they want to talk through. So that's something really special where we are providing care from start to end without our pet parents even needing to leave their house at all. And just looking at kind of the breakdown of our process that we follow through Loved, we start with that guided beginning. So whether that phone call, that text, that email, we are going to guide them through kind of what that looks like from the very start. And like I said, with Haley and Holly on the phone, guiding these pet parents through some of their emotions and their feelings and their questions about the process. Again, we're unhurried. We are going to take our time with them. This is something that a pet parent can quite literally schedule with us. They can schedule a time to talk on the phone, and that helps them to kind of emotionally prepare, or maybe they need to speak with family members first. And then we move into our compassionate planning. So are we moving forward with a quality of life assessment appointment, or are we moving forward with an in-home euthanasia? And then we're going to kind of talk them through some of those aftercare options, maybe talking through what to expect at that time of appointment, and just allowing them to prepare for that. We have that unhurried visit where the veterinarian's coming into the home and having that discussion, performing an exam, performing euthanasia if warranted or pursued. And then, of course, we are going to follow up with our pet parents. So when we leave the door that day, we are not leaving them alone. We are going to be following up with them very shortly after. They have our contact information as well if they want to reach out at any point. And we're going to keep in touch with them until we are able to take back either those cremains or those memorial items and bring them back home to those pet parents. Even after we bring some of those items back home, again, we still have continued support for them after. So I'll share a little bit about our grief support resources that we provide for our pet parents. I know I stay in touch with a lot of pet parents, or they'll randomly send pictures of their fur babies. And then as you see in the last circle, our loved community, we have all of our previous pet parents stay in touch so that if we are hosting an event, for example, like our Rainbow Bridge Day or a local community event, we want to be able to kind of stay in that circle with our previous clientele and stay in touch with them. And we want them to know that we're still here for them, even beyond that appointment. So anytime people can call or text our 85 Loved Vet, our email is care@loved.vet, and that's our website right there as well, loved.vet. Weekend and evening appointments available by request, so I recommend reaching out. And our support hours, this has been extended a little bit as well. So Monday through Friday, 8 to 7. And then we have some other additional hours as well. So definitely reach out, recommend pet parents to reach out as well, and we will get in touch with them as soon as possible. Like I said, for our veterinary and our grooming staff that has been taking care of their fur babies and other fur babies day in and day out, we do have discounted 50% off appointment cost for anyone in the veterinary or grooming industries. And then Francesca is going to be our social worker who provides our grief support. So this is going to be a free resource that we leave with our pet parents. The reason that this is so important for everyone is because this is not just for our clientele, but also for anyone in our communities that needs this support. And Francesca's wonderful. I definitely recommend pet parents to utilize her. She's a wonderful resource to hand out to pet parents when they're leaving. Maybe they had an unexpected euthanasia appointment and they're walking out that day from your vet clinic, and you want to be able to send them with something that says, hey, I am thinking of you. Here is someone that you can talk to moving forward as well. It makes them feel a little bit more supported walking out of your doors that day. And that is all. Those are all my little weirdos and my 2 senior dogs. So thanks so much, everybody. Does anybody have any questions?
I wanted to know, based on your experience, actually, what do you find some of the most common things that are highlighted in an appointment that stick out to you that a pet was in pain, but the owner didn't recognize or realize just because the pet is not vocalizing or actively limping or something like that? What is it that they've mentioned or that you can see that triggers, yes, this pet is uncomfortable, yes, this pet has been in pain, but the owner didn't recognize it?
I honestly feel like unidentified pain is probably one of the top things that we notice in senior pet exams. And I think, just like you mentioned, it's hard for pet parents to identify that as pain itself. And they might even think, oh, Fluffy's not in pain. He's just not eating, or he's not acting himself, or he's not going on those long walks that he used to. So I think it's not even something specific change. I think it's any change that we notice in our senior pets can stem from pain itself. And so it's important for us to not only ask those really good questions to our pet parents, but also perform a really good exam, because we might be able to identify some of that pain on exam, which is good to show pet parents. I will have pet parents actually grab the knee that I'm feeling the arthritis in and feel that with me. Or I might show them how that pet tenses up when we're feeling their spine or their belly. So I think that a lot of times pet parents will say, oh, Fluffy's not in pain. He's just been spending more time in the closet or in the guest room that nobody's in. And I think some of those things are triggers in our brain of, okay, maybe Fluffy is in a little bit of chronic pain that we need to identify. But that's a good question.
Yeah, I think I would see a lot of the same things. And I think it's a delicate balance of how to even mention those things or try and describe them, because we certainly don't want anyone to feel guilty that they didn't recognize it.
Yeah. And I'll even address that as well. I'll say, they're really good at hiding this from us, especially like our cats, for example. They are really good at hiding pain. And that might just be them hiding under the bed one day, and they've never, ever done that before. That might be the very first sign. So I think kind of giving those pet parents grace and just identifying the fact that, hey, they're really good at hiding these things from us. So I'm really glad that you brought Fluffy in so that maybe we could figure out some of this pain today.
And that's a great way to also start a conversation with anyone that needs to start watching for that. And I think what we want to preface too is the fact that just because they decide to reach out to us does not mean they're committing to an end of life service. Certainly our quality of life assessments, we take great pride in those because we do spend so much time preparing for them. But also I would say those appointments do extend close to the 2-hour mark, even sometimes a little past it. We won't tell, but just because they are so inclusive with what we need to gather information-wise in our assessment. And then the follow-ups for quality of life assessment, whether that be management or continued communication, that in itself is built into that price for an in-home service, because all of a sudden these patients are established as loved patients.
Yeah.
So great point to bring those up as well.
Definitely.
Well, certainly we thank everyone for joining us this evening. And if you have any further questions, you know how and where to reach us. We're here for all of you, and I hope you have a wonderful evening.
Okay. Thanks, Dr. Stephanie.
Thanks, Dr. Lindsay.